Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN. Healthy world, healthy nation, healthy you. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And our show today is going to be on healthcare reform, as one of the goals of this program is to help translate healthcare reform for you, the consumer. And our topic today is the Affordable Care Act. Will it really make healthcare affordable? And the most important thing that we're going to discuss today is access to services. And I want to introduce our guest, Rosemary Gibson, who is the author of this book, The Battle Over Healthcare: What Obama's Reforms Mean for America's Future. Excellent book that really has taken a nonpartisan view of these issues, and she is going to share her wisdom with us today. So specifically, what I'm going to be posing to Rosemary that will be the focus of our discussion is what problems did healthcare reform really try to address? And part of that is why the healthcare reform law defined the problem as lack of insurance rather than affordable access to services. Secondly, will people be able to find a doctor or other licensed healthcare provider, such as a nurse practitioner or a physician's assistant, once they do have an insurance card? And what does that mean in terms of burden for the primary care system that we have in the United States? And then thirdly, how will viewers be able to be smart when using the healthcare system? Now, I know that's a mouthful of questions, but I'd like to start with you, Rosemary. First of all, tell us why you wrote this book, which is such a clear discussion of all of these issues.
Well, thank you, Nancy, for the chance to be here today and to talk with your viewers. I wrote The Battle Over Healthcare as soon as the ink was dry on the healthcare reform law. And the reason I wrote it is because I wanted to take a public interest perspective to it. Not a Democratic one, not a Republican one, but ask the question, what does this mean for the American people? Did they get a good deal? Where is it headed? And just put the facts out there, how the deals were made with the drug companies, the hospital industry, and the insurance companies. How did it happen? And again, did we get a good deal? Are we going to be better off because of it?
Right. Well, I think that's going to be the jackpot question. We're not going to answer that question in this show, but we're going to take a step in that direction. And I think that the first question was, what problems did healthcare reform really try to address, and how that really links up with access to services?
Well, Nancy, we're beginning to see that people are beginning to get health insurance under the healthcare reform law. And once people have that insurance card, the big question is, now what?
Right.
Will I be able to find a doctor, a licensed healthcare professional like a nurse practitioner, that I can go to? How do I use that card? Particularly if you haven't gone for medical care in a really long time. Or if you're in a new provider network because you've had to change your private health insurance plan. Are you going to go to the same doctor that you've had all along, or do you have to choose a new one?
Right.
But the big question is, a lot of people are going to have insurance. Are they going to be able to find primary care?
Right, but I think the answer to one of the questions posed was that in your book you've already talked about that, and I think everybody that's been listening about healthcare reform all along sort of understood that insurance was the turnkey to access.
Right.
That if you didn't have insurance, you weren't going to have access to preventive services, primary care, tests when you need them. So now that you say we were going to have an insurance card one way or the other, right, what do you think is going to happen? Are we really going to solve that problem is what I'm asking.
Well, it's the way I write about in Battle Over Healthcare. We built a house. It's like building a house with this healthcare reform law. But we didn't ensure that there was a first floor. And I call that first floor access to basic care. What does a primary care provider do? They make sure you have your immunizations, and they take care of a lot of general medical concerns that people have that don't require a specialist. And in our country today, we have even today, before we have more and more millions of people with insurance coverage, today it's really hard for many people to find an internist or a family medicine physician.
That's true. Or to wait very long for your first appointment.
That's exactly right. So if we have trouble now, what's going to happen when more and more people have access to care? So the healthcare reform law, they tried to solve the insurance problem. They tried to fix the insurance market. But now that people will have insurance, then what? Are they going to be able to find access to care?
Right.
Big question.
Well, how do we compare to other countries, other developed countries that we're often compared against in terms of outcomes? Are they more steeped in a primary care model than we are? And if so, what difference does it make?
Yes, other countries have a much greater emphasis on primary care. In this country, we have 70% specialists and 30% primary care. That ratio is flipped in other countries.
Interesting.
Because there's a much greater emphasis in other places on health, not just health care. There's a difference. If it's health, it's how can I keep you, Nancy, healthy? What can we do to make sure that you don't have to go to the hospital if you have any chronic conditions that they don't, accelerate? Whereas in the United States, our emphasis is on health care. We don't really think much about health. And that's emblematic of the fact that we don't have much of a primary care infrastructure. So where are people going to go to get basic medical care and to coordinate all other care if they have a serious illness?
It is definitely going to be a huge challenge with the lack of physicians that are going into primary care. And I don't see that changing, do you?
There's good efforts to try to change it, and there were some small provisions in the healthcare reform law to bolster primary care, but they're really very modest, and I don't, unfortunately, think they're going to have much of an impact. And I guess the big question is, how did we get here? And is it just by accident, or if every system is designed to achieve the results it gets? Why don't we have enough primary care doctors? It's because we have too many specialists.
Right.
Because that's most lucrative for the industry.
Right. And I think that the whole medical education focus has changed in this country because it's become so high tech that I think when young students go into medical school, they can't help but be dazzled by going into the specialties for which there is a lot of technology, much less so in primary care. Primary care is family medicine and individuals coming through their doors, a lot of elderly people. It's just not as jazzy and pizzazzy. It has other kinds of gains. I mean, it's very wonderful to spend time with people's families over a lifetime. It's a different kind of payback. I'm not speaking about financial payback, but just the kind of reasons that you get into becoming a physician to begin with. But because there is so much emphasis on technology and specialties, I can see where the average young student would be swayed into that.
Well, there's certainly a lot of pressure for them to go into what in fact are higher paying medical specialties. Primary care physicians don't make nearly as much money as someone doing colonoscopies every day. In fact, if there have been studies shown that a primary care physician who may take care of a patient with a lot of complex conditions and have a half-hour visit, compare that to how much a gastroenterologist may make doing colonoscopies, is vastly different. Which is more important? Certainly taking care of a person with complex conditions, not doing procedures, is really important to that person's health. But our medical care system has not rewarded that.
Right. I think that one of the other remedies that is being used to address this is increasing the number of nurse practitioners and physician's assistants to really take up and fill some of those gaps in the primary care system. But that's really not necessarily an organized and coordinated approach on a national strategic scale.
That's right. And if we look at our society, just look at the television shows. Years ago, for younger viewers, they won't remember Dr. Welby. Dr. Welby was a television show that featured a primary care physician who knew the patients in his community, and they'd come in and they'd talk about all kinds of health-related issues. It might be substance abuse that's pretty sensitive, or maybe some mental health issues, or a bad knee, or an aching back. But if you notice today, what's on television? The medical dramas are all high-tech. Let's do something. You look at Grey's Anatomy. Those are it's all about surgeons. There was a television show called House, And that was, the irascible physician who could be the mastermind of, uncovering a diagnosis by doing a gazillion tests. What's happened to us? The public sees that and they think that's normal medical care.
Right.
In fact, if you look at the credits for that one program, House, where all these tests are done to uncover, which most people don't need, some of the credits are for companies that sell equipment used in those tests. So we have a very high-tech perception that we're putting out there for the public that keeps it going, when in fact what a lot of people need is just a good doctor who can help them with common medical conditions.
Right. Well, that's an example, I think, in a different way, that sex sells. They make these shows very sexy.
Sure.
And very entertaining, but as you say, it really doesn't give the image of reality and the kind of care that people are doing in the trenches.
And what's really good medical care that will keep you healthy?
Right.
What will keep you out of those situations?
Right.
There's some places in this country, we were talking earlier about the state of Vermont, that really is taking the healthcare reform law as an opportunity. And so they ask themselves, we are spending $5 billion a year in our state. How can we achieve the best health?
Good question.
If you ask that question, that should promote access to basic primary care, make sure everybody has an entryway, and not have to get into the revolving door of going to all different specialists and trying to have to figure it out and coordinate it themselves.
Well, then the reality is that there's not going to be enough primary care, is what you're saying.
Right. And you know what? Here's a reference point that was really helpful for me to understand how big healthcare reform is, how many people are coming on board. Up to 32 million people if everybody signs up. How many people is that? That's like adding the combined populations of today of Austria, Israel, Hong Kong, and Switzerland.
That's a lot of people.
Now some of them already are getting medical care, but they're all going to have insurance cards, and chances are use will go up. The question is, will they be able to find a provider to take care of them?
Right. What do you think about the new clinics that are springing up in the pharmacies, such as CVS and Walgreens? I think their plan is to really take over this gap and to have nurse practitioners helping people with primary care and long-term chronic care management. What are your thoughts on that?
Well, I think that's the market responding to gaps that people see in how they access care now. So if you have a hardworking family physician or primary care physician, he or she can't work, 7 days a week necessarily. And so people get sick, though, all times of day and night. They have a sore throat that doesn't seem like just a regular sore throat. And there are places like that can handle those routine. But that is no substitute, however, for a good foundation of primary care to ensure that people are healthy. Remember, those urgent care places, they're episodic.
Right.
We want people who are going to really manage people's care over the long term to keep you healthy.
However, I think that we are seeing a lot of technology added to this equation. So I wonder if the view of primary care will look somewhat different in the future, meaning that with technology, having a way of reaching out to clients in their home, having more information exchange, do you think that this will help to close that gap? Or do you think that it's not enough? It's just it's a nice thing to have, but it's still not going to address the fundamental problem.
I think there's wisdom in what so many other countries have decided to do and say we basically need a whole foundation that's based on health and wellness rather than health care. And to do that, I think we do need to build the infrastructure of good basic medical care that's accessible to everybody.
Right.
And it's not clear under the healthcare reform law that people will be able to do that.
I think that one of the things that's really hard for people to understand in this country is that we think our healthcare system is wonderful if you've used it and if you have not been harmed and if you've gotten really very good outcomes and results. We spend a lot more money per person in this country than anywhere else on the planet. Yet when we see our outcomes ranked, that means what happens as a result of all of this care it is shockingly low as compared to other developed countries. It's really almost hard to believe how you could spend so much and get so little in return. There is really no other industry that I can think of that we are familiar with that would spend that much and expect to get so little in return and just basically live with it.
And that's because our system is about health care. It's not about health.
Right.
It's not about the ultimate outcome. You know, I'd love to tell you about that little mystery shopping that they did down in North Carolina in Research Triangle area to see if there were physicians available to take care of older adults on Medicare.
So what's a mystery shopper do?
Well, what they did in North Carolina was they had, again, this is for older adults, but I think it's a sign of what's going to be around for everybody.
Everyone, right.
So they had AARP, volunteers from AARP to call up family physician offices, about 200 of them. This was reported by a local television station down there, and I reported in the book, Battle Over Healthcare. And they called up and said, are you taking new patients? And only about 50% of these practices were taking new Medicare patients. I should be clear about that. And they said of those that they were taking, people would have to do their own forms, you know, take care of all the reimbursement.
Oh, okay.
And so if there's older adults that can't find good access to primary care on Medicare, what's going to happen with all the people who are coming onto Medicaid, which actually pays lower rates to doctors? Are there going to be enough people to take care of them?
Right.
Big question.
Well, I think it sounds like from what you're telling us, the answer is no, and no means that maybe not right this minute, but it will be very interesting to see how the market will respond to that, because
Yes.
it doesn't sound to me that there's any dialogue going on a national level
Right.
that says, okay, step 2 of healthcare reform of the Accountable Care Act is going to be building a primary care system in the United States. Is that dialogue going on to your knowledge?
I think there are some professional people in the academic arena that have been talking about it, but from a policy point of view, no. And I think if we really want to have the right conversation, we're going to need to talk turkey and say, do we need all these specialists that perform, you know, there's a lot of overuse of unnecessary tests and surgeries. Now, it would be great if they could stop doing things that people don't need and use their talent and skill on people who do need it, the newly insured.
Right.
But we've got to have a big conversation in this country about, do we want to be about health or do we want to be about health care?
And who would start that conversation?
Frankly, if this were me, I would start it among older adults, because they have the most at stake. They're the ones with the most most conditions, because just as a matter of age, and they're the ones who are seeing the effects already of not having someone who can coordinate their care, who can take care of them throughout the continuum. And they get stuck in the revolving door of going from doctor to doctor to doctor to doctor. And I've interviewed these people. There was a gentleman, he used to be a newspaper publisher, and his primary care physician retired.
Mm-hmm.
And he said, I'm lost at sea. My doctor used to explain this test result, that test result when I went to see a specialist, and told me how to make sense of it. He's lost now. And a lot of older Americans are experiencing that, as well as people who aren't yet on Medicare. But they have the most interest, the most vested interest in ensuring that we have a workforce that's around to take care of them and meet their needs.
Right. However, the way medical schools, even nursing schools, all the professional disciplines are very focused on specialty care, because our whole model of care, hospitals, clinics, are very specialized. How would we disaggregate, meaning take apart, slice and dice this, so that we could come back with a new model of care? I mean, that is not something we could do easily.
Well, I think there'd be a huge market, and I say this to the people in the world of geriatrics, that those are specialists who take care of older adults. And they're basically primary care physicians that specialize in that population.
And there are a lot of nurse practitioners that have specialized
Yes, geriatric nurse practitioners. Right. And unfortunately, that field is really fading. And from a physician point of view, most of the doctors that go into that are graduates from medical schools overseas. But I bet that if enterprising minds, hopefully from a nonprofit perspective, could set up clinics devoted to the care of the elderly and provided not just episodic care, like we have with these urgent care places, but over the long haul, I bet that people would be lining up around the corners to bring their moms, their dads, their aunts and uncles for good basic care to manage it, because a lot of people don't have that now.
Correct. Well, that is a very good idea. I think that the dialogue that we need to have really starts with people that are listening to this show really talking to their current treatment team and getting a better idea of sort of what they're up against.
Right.
Trying to do more with less and for more people.
Right.
So perhaps some of the entrepreneurial or creative things can be done community by community, because they're really, from what we're saying, it doesn't seem that there is a national plan to address this.
Well, I think there is some concern that we're seeing there's hospitals in some communities that are building, billion-dollar buildings.
Correct.
And complexes. But again, people need basic care, and that's where the money is. Because you can bill for cardiac services and orthopedics. That's a big money maker. The big money makers are not, the basic run-of-the-mill primary care, get what you need to keep you healthy.
Right.
Whether it's children, adults, at all age of the spectrum. Who's investing in that? There isn't a huge financial return on that, but there is a big financial return on all these other services.
Right.
And that's why we're seeing this lack of access.
I think one of the ways that the nursing community has addressed access is that for many decades now, there have been clinics that schools of nursing have set up so that they would be able to have two aims, in addition to meeting the needs of the community, and often you will find these in underserved communities.
Right.
Very poor communities, like the places that no one else would go into. The nursing programs would go in and they would set up a very comprehensive primary care clinic.
Yes.
The goals would be to really keep their faculty refreshed in their skills so that they would be able to continue growing and developing, and also have a place to bring their students, because there are really never enough clinical sites to do all the training and hands-on work, and so this would give that opportunity as well. So I believe that, again, it's just a small piece of a very large puzzle, but that could actually be continued. Things like that we could build upon that base.
It certainly can, because we know, well, if people in that community suddenly have health insurance, that will bring more money availability into the system. And if you have good people with good intention coming in to build capacity, where people can go see a nurse practitioner, can see a primary care physician, that would be a good thing.
Right.
The alternative is the big money comes in and says, now these people have insurance. I'll tell you a story. This was a wonderful dean of a nursing school when I was writing a book about overuse called The Treatment Trap. She said something so wise, and it was just off the top of her head. She said, health insurance used to be about giving patients access to providers. Now it's about giving providers access to patients. So you can bet that there are a lot of people be watching where people are signing up, getting insurance, being a source of money, and those services will follow. The question is, will they be the right ones that keep people healthy, not just do a lot of things to them, because that's how money can be made.
Right. But I think one of the things that you've made very clear in this discussion is that primary care is about having a good relationship with your treatment team.
Absolutely.
It's not something where you can just drop in and have a service provided, or you could get some information and some education.
Right.
It's really that long, sustained relationship with an individual, their family, understanding how they fit into that community. It's a very personal service.
And we're seeing that some people are having those relationships broken. Those who've had private health insurance policies that are being canceled, those 10 to 15 million people whose current insurance policies don't fit the standards under the health reform law. If they have to pick a new plan, they have to see if those physicians, some of whom they may have had a long-standing relationship with, are part of that provider network. If they're not, those relationships are going to be torn asunder. And a lot of people are not going to be happy because their access to the people they want to go to will be curtailed.
Yeah, I think that that's going to be one of the fallouts of all of this.
That's right.
It could be a double-edged sword. You lose for mainstream people that have been insured or have been insured under their employer, and some of that is changing as well. Right. Having to pay more and then experiencing less service or less access than they may have had in the past seems like a bad outcome.
I think it is. It's not a good outcome. I don't think anybody would want to be in that situation. And I think what we want is not just, good health, but if we had a really good primary care system that focused on health, it would be on teaching us how to take care of ourselves.
Correct.
What food to eat, what not to eat. And really I had a wonderful conversation with a primary care physician who said, I wanted to help the people in my community. A lot of them were overweight. And he said, I wanted to help them. So he was losing money, but he set up this practice where he helped the local policeman in his community and a guy from the fire department and a local lawyer, help them be real partners and move from not great health to a place that was much better.
Correct.
That's what we really should be expecting.
Right.
The healthcare reform law doesn't help us move there, and we're only hoping to the winds that it might. But without a deliberate strategy, we're not going to get there. But that is the place where we should be.
Right. But I think in the meantime, part of what this show is hoping to help you do is have those kinds of conversations so that you can do some of your own self-assessment, decide what you really need to focus in on for your own health, wellness, and stability, and start working on some of those things. Find services that will really help you lose weight, get more exercise, smoking cessation, stop smoking, curtail alcohol intake to something that's more moderate. All those things are associated with better health. So in some ways, if we all took more responsibility for our health, we wouldn't need as much primary care anyway. We would still need some primary care, but we wouldn't need maybe as much as we're using now. So that is something that really does contribute to an already overburdened system.
And it's nice to have somebody help you in that journey. Help you. I loved back to this primary care physician. You know what he did? He kept a chart. And the patient, they both looked at it together on how well. They looked at the impact of a small behavior change had on their health status.
Right.
And they tracked it over time. And the patient really felt a part of it, saying she really felt that, yeah, this is having an impact. The physician helped him do that.
Right.
That's the ideal.
Right. That is ideal. But I do think that with technology, there'll be other people that can really unbundle some of those services. People are now wearing wrist devices where they can download how many steps they've taken, what their pulse has been, how much they sleep at night, what their sleep patterns look like. They can chart that for themselves. So what's different in this world of technology is that people are doing a lot more for themselves in this area.
We have to be doing that because, as I said, in the battle over healthcare, we have to be our own commander-in-chief of our healthcare.
That's very well put,
because
Rosemary.
You might be lucky to find somebody, but ultimately it comes down to you as being the one in charge.
Well, I think that's a great note to really think about our points today. We've talked about healthcare reform in regards to access. We've identified that we do have a very overburdened primary care system as it stands now, and that we really need to have, as part of our social policy discussion, a re-emphasis on primary care and find new ways of delivering primary care to the many, many more people who are going to have the health insurance card, and for all of you that have had it all along as it's changing. So this dialogue, I think, is really also important, that you be commander-in-chief of your own health, because the more that you get involved in prevention, wellness, and really helping to figure out what you need and then taking the steps to get it, whether it's through primary care or other sources, will really help you to stabilize and stay healthy. I want to thank Rosemary Gibson again today for being with us. This book is excellent. If you want a snapshot of healthcare reform and how we got to where we are today, I think reading The Battle Over Healthcare, What Obama's Reform Means for America's Future, will be for you, like it was for me, a very clear wake-up call about what we need to do, taking next steps in this changing landscape of healthcare reform, which touches each and every one of us. Thank you very much for joining us. I hope that you can catch this and other shows on drnancyrn.com. Thank you for being with us, and have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening and join us again. And remember, with health, all things are possible.